I'm an assistant professor of surgery. I'm in the division of urology, and I'm also the director of robotic surgery here at the University of Colorado Hospital. My practice is mainly urologic oncology, so I see most patients with prostate cancer, testicular cancer, kidney cancer. Urologists in most cases are more comfortable dealing with somewhat touchy medical conditions. This is something that we as urologists deal with on a day in, day out basis. We're also, dealing with the genital region, and again, an uncomfortable area, but we're pretty comfortable talking with patients about conditions they may have. The types of procedures that I would do most frequently would be robotic radical prostatectomy. We also do open surgery of the kidney, but some robotic surgery of the kidney, and then complex surgery for metastatic testicular cancer. Well, prostate cancer is very common as men age, and it's gotten a lot of press recently because of prostate cancer screening. Is the PSA test really worthwhile? But in any case, we're left with many men with prostate cancer, not all of which is necessarily life-threatening. That said, it's a frightening time for many men. The patients are often, and I encourage patients to get a lot of different opinions because they have many different alternatives. The alternatives mainly are going to be surgery for removal of the prostate, radiation treatments for treating the prostate cancer, and watchful waiting. There are some other treatments that are available out there, but these are going to be the three main categories of treatment. Why would somebody choose one type of treatment over another is fairly complicated. I usually try to tell patients, quite honestly, what to expect with the treatment so that they can try to make the best educated decision that they can. The side effects are slightly different. For instance, with prostatectomy, it tends to have a slightly higher effect on a man's sexual function. With radiation, maybe some more impact on the intestinal system. All these side effects have different rates at which they occur, and it's nice to have somebody have a good understanding of what they're in for before they would make a decision. Almost always it's a urologist that's making the diagnosis, mainly because we're the ones that actually do the prostate biopsies that confirm that prostate cancer is present. The next steps tend to be extremely variable, so usually they're going to meet with that urologist to discuss the next steps. Is treatment necessary? What treatment would you recommend? And if I'm seeing these patients, I'm also usually referring them to some other specialists. I try to let the patients, give them the information, what I've experienced with my patients, and then, if I can be of help to them, then that's great. If not, then I try to point them in the right direction to get the treatment that they need. So the things that move me the most are quality of life issues, either in prostate or testicular cancer. So how can we do the surgery better so that you're less likely to have problems with impotence, so that you're more likely to regain your urinary control, that you still have a very good cancer-related outcome. Those types of things I try to personally measure very carefully in between patients, and is one of my main focus of research.